Today's meeting was part of a series that the Global Health Council has organized together with the Results for Development Institute. And the question we were looking at is, how is it that we can understand why all of the billions of dollars that have been put into global health in the past many years haven't led to better improvements in health outcomes? And to address that question, we took a look at how civil society organizations, non-governmental organizations, can play a role in really helping to ensure that governments are held accountable for the money that they're using and that they're using it in the right way.
I am presenting on the Transparency and Accountability Program, or TAP. TAP is a program that we run out of the Results for Development Institute, started in 2006, and the mission of TAP is to support the capacity and strengthen the capacity of civil society organizations.
We had several examples, one from South Africa, one from India, and one from Uganda, looking at ways in which civil society organizations have been actually monitoring what governments have been doing with this health money.
We are working with the TAP on community monitoring of absenteeism and service delivery in the health sector in one of the states in India, that is Rajasthan. The study is not yet completed, but we have crossed halfway, so some of the interesting findings are emerging out of this study.
So one of the things we try to support at TAP is organizations that are actually doing this work on the ground on a day-to-day basis and can really work to improve the way that health systems and education systems are working.
The motto for the last few years has been, not only do we need more money for health, but we need more health for the money. And the examples that we heard in today's presentations are ways to ensure that we're getting more health for the money.
The people's participation can help in improving the public expenditure outcome, which is a big issue in most of the developing countries.
It's only by getting communities directly involved in delivery of the services that governments are making available that we'll be able to get the most efficient and the most effective use of those resources. So I think that perspective, that communities are really the most important and critical component of helping to improve global health, is one that will stay with people.